The second claim has to do with type 2 diabetes, and there are short-term benefits from keto diets. They produce weight loss, they improve glucose control, they essentially can flatline blood glucose, they reduce A1C, they lower triglycerides, and they can reduce medication use. But the downside is that keto diets help reduce symptoms of diabetes, but they increase insulin resistance. If a person eating a very low carb diet is challenged with a load of carbohydrates, they have very significant spikes in blood glucose because they become even more insulin resistant than they were before they started the ketogenic diet. So why do these diets fail to reverse insulin resistance? Well, they fuel the drivers of insulin resistance: lipotoxicity, inflammation, oxidative stress, and dysbiosis. And lipotoxicity is just when we store fat in places where fat shouldn't be stored, like our liver and our pancreas, our vital organs, and our muscle tissue. And dysbiosis is just an unhealthy gut flora. You can't support a healthy gut microbiota when you don't feed it. You need to feed it prebiotics, and prebiotics are packaged in fiber. And by very definition, low carbohydrate diets are low plant diets, they're low fiber diets. In the long term, we don't have any long-term studies with ketogenic diets, but we do have a systematic review of low-carb studies of over 12 weeks, and there were no differences in weight or A1Cs with longer-term treatment when compared to low-fat diets, low GI diets, or usual care diets, when we're comparing to low-carbohydrate diets. Low-carb diets and type 2 diabetes, we have another study with over 40,000 individuals. It was a health professionals follow-up study. There were almost 2,700 cases of type 2 diabetes, and low-carb diets, they weren't keto, but they were high in animal protein and animal fat, were associated with a 37% increased risk of type 2 diabetes. Low-carb diets that weren't keto again, but were high in plant-based protein and fat, were not associated with an increased risk, but overall were associated with a 22% decreased risk in men under 65 years of age.